We're joined once again by Bob McKinny, a clinical social worker and on staff here at the University of Alabama Medical Center. It's good to see you again.
Glad to be back.
Thanks for joining us. You talk to us about issues that most of us don't understand, and that's why you're trained in this area, and you can help us understand more about it today. We're talking about adverse childhood experiences. Before we turned the camera on, I said, well, I think I had some adverse childhood experiences. I guess we all did. The severity of them, though, is what you're talking about. Those that are so severe that they affect someone for the rest of their lives. In a nutshell, what has research told us about this? What do we know today that maybe we didn't know when you and I were children?
So thanks for the question. We get the term adverse childhood experiences from a research study that was begun in 1995 by a physician at Kaiser Permanente in California and another researcher at the Centers for Disease Control. And they asked about 17,500 adults about their exposures in childhood to adverse experiences, including experiences of abuse, physical, emotional, sexual, experiences of neglect, physical and emotional, and various types of household, what we might call today dysfunction, including separation of the parents, a parent with a mental illness, violence against mother, things like that. And one of the things that the research showed was that these ACEs, as they have come to be called, are very common. As many as 12.5%, that's 1 out of 8 of the general population, should be expected to have experienced 4 or more ACEs. So we know that they're more common than we had previously anticipated. We also know that once you get to 4 adverse childhood experiences, we start to see some negative health outcomes as we grow up, including increased likelihood for alcohol abuse, substance abuse, depression, suicide risk, various things like that.
And I know that you know, the people watching this right now, many of them, maybe 12%,
sure,
but many of them either experienced things that you listed or know people who experience those things. This is very concerning and very troubling for children as they become adults because it's not something you just get over.
That's correct. So what we know is that there's sort of different ways to look at it. We know that people who do what I do, healthcare providers, we need to be aware of this when we're working with our patients or our clients. We also know that we need to do a better job of educating the public that the way that we interact with our children can have effects, will have effects down the road in their lives.
Imagine the young person in a home where there is an issue, let's choose one, severe alcoholism. They may as a child go, boy, I'm never going to be like that. My dad has a problem, I'm never going to be like that. But unfortunately, there's a possibility that they indeed may become like that.
Yes, there's been other research that shows that many of these types of patterns of behavior are in fact generational, and what we see in the exposures of one child, that person's child may also have.
You're trained to deal with this, to talk to people about it. Are general practitioners, physicians who see kids all the time, are they able, with trying to worry about the physical health, able to maybe recognize some red flags, if you will, that this child might need some guidance regarding home life and some things they're dealing with? Are we getting there?
I think we're getting better at it. Historically, medical education has, at least for the last several decades, has concentrated more on the biophysical things. But we're starting to have a better appreciation of that through research of how important the social factors are. And we are doing a better job now than we were.
It would be very helpful if school administrators, school teachers, school counselors especially, might be looking out for children who seem troubled, and if they can, within the parameters of their jobs, guide and help young people who may be troubled because of these conditions as well.
That's correct. Remember that our teachers spend more time with our children than their family members do, typically. So
that might be helpful. Button this up for us with some advice. We'd love to get free advice from you folks when we get you on camera. Give advice to people who see a problem. Maybe not even their own children, but they see a problem with a child that obviously is dealing with some issues that just might be severe enough that it's going to affect them for the rest of their life. Give us some things to be on the lookout for and what action to take, because it would be easy to say, well, gee, I wish there was something I can do. What can people do generally to help with these issues?
So at first, let me say you might look for children who seem to be socially isolated or who don't interact well with other children. But that's not necessarily, the indicator, but it's sort of a way to maybe identify one child who might be struggling with an issue. Start by talking to the child. If you can have a relationship with something, you already opened a door. And if you have a genuine belief that there's an issue with a child, particularly if there's a child who you believe is in an abusive situation, you're obligated morally, I believe, to report that to someone. It depends on the setting. If it's in school, report it to the teacher and let them take it from there.
The research you mentioned was done in '95. Probably not a lot of research done before that about this. It's being dealt with with realistic numbers and in a better way now, and hopefully we'll even do better going forward.
I believe that's the case, yes.
Yeah, very much, very good. Thank you so much for joining us. We appreciate your time and your expertise, and we'll look forward to having you on again.
Glad to be here.